Hi, everyone. I'm Dr. Anita Wong, and I'm a board-certified emergency medicine physician, fellow in anti-aging metabolic functional medicine, and I'm practicing preventative medicine, preventative aesthetics, focusing on resilient immune um, system, restoring energy, better intimacy, stronger core, anti-leaking, anti-sagging, to improve your quality of life with optimal health and vitality to the end. And today I really wanted to speak about the small little gland that's in your neck. And I think some people actually have heard about where people on television or newscasters or something, and people were watching audience and they noticed that there was a little lump and they saved them and they had cancer or had a goiter or something. But it's a small little butterfly um, organ that produces crucial hormones in your body, and it can affect the heart, the brain, your liver, your kidneys, and you just want to check that. Always have it checked. And it's interesting because history-wise, back in 2700 BC, seaweed was given as a treatment by the Chinese emperor Sun Nung, and he was treating the thyroid gland because of goiters and things that he noticed. So, it's a master gland, can have can create dysfunction in all parts of your body and energy, your calories, your hormones production. It helps the liver to break down the cholesterol, and it helps to control your triglycerides. It helps regulate your heart. You can, if it's off your thyroid, it can cause sluggishness, moodiness, slowing down, difficulty losing weight, depression, anxiety, infertility, feeling cold, constipated, tenderness, kidney problems, stiffness in your joints, crackly skin, dry skin, menstrual changes, troubles breathing, so many different things. And then those swellings and those things that I was telling you with the nodules is the buildup of cells, tissues, abnormal tissues. And they may be benign, they may be dangerous. You could have them for a long time. They usually tend up happening, as we mature along the line. They can convert to being cancerous, and many things that if they turn cancerous, you're going to use radioactive iodine to destroy those cells, and hopefully, and also not kill the thyroid itself. But just some. So before we, dive into that, just some in generality, if you're not having anything, but just want to know what you can do that really helps the thyroid and your adrenals, and you want to take adaptogens. So adaptogens have been around for thousands of years in Chinese medicine, and one of the ones that I like to use that really helps is ashwagandha. So it's a great one. Ashwagandha, holy basil, rhodiola, ginseng root, licorice. All of these are adaptogenic herbs that are natural treatments for hypothyroidism, Hashimoto's. So some of the other things but I think testing is really where you want to know and where you want to go. But in general, you want to make sure selenium is good, and so which is a powerful antioxidant, and that is found in Brazilian nuts, yellowtail. Your cooked and other things can be cooked tuna, sardines, grass-fed beef, boneless turkey, breast, beef liver, chicken, egg, spinach, and things like that. And then the other things that are good for your thyroid are the B vitamins and B12, and that is associated with a lot of energy. So taking that, so you want to be deficient in that, and that's also found in beef and liver, and always want to have grass-fed sardines, some tuna. Raw milk, I think, is a little bit better. Also, it's in greens like peas and asparagus and Brussels sprouts, sesame, sunflowers, pistachios, and cremini, mushrooms, flaxseed, ground up flaxseed, spinach. Those are all good things for your thyroid. Um, excuse me. So the other things would be probiotics, having a balanced gut. So if your gut is not balanced, that's not going to be good because you're going to have some leakiness and create some problems and letting some toxins that will go. So I want to make sure that your gut is not so maybe probiotics. Proteolytic enzymes, they can reduce enzymes like bromelain, would really help. So anything that decreases inflammation is really helpful because you don't want to have autoimmune or inflammation of your thyroid. So diet is a big key. So let's just kind of dive into a little bit because I'm covering a lot and all of these things because I'll just give you a little focus of things that to, but so hypothyroidism. So that's when it's low. That's when it's slow. That's when it's not working as efficiently. Um, and it can be, seen more with autoimmune and diabetes, rheumatoid arthritis, celiacs have a higher risk of developing uh, hypothyroidism. It can affect your metabolism and your heart, your digestion, your sleep, your appetite, your mood, the growth of your hair, your skin, and your nails. And um, uh, this usually, the autoimmune is the Hashimoto's thyroiditis. So that's the inflammation. It's autoimmune, meaning it's attacking itself. And so what we would look at in this is, how did this develop and why do you have hypothyroidism? We need to look at different reasons. So some of it could just be diet that was lacking in iodine. So if you're not taking enough iodine, could produce a little bit of thyroiditis, and then when it does that, you prevent having your antioxidant, which is glutathione, which can prevent oxidative stress and inflammation. So really getting the right amount of iodine in your diet is important. Um, some other things is that the pituitary, if that's just off balance and not producing enough of your TSH, and the controls of that hormone. So being aware, trauma can affect the pituitary. Again, I mentioned leaky gut. So those can just cascade into autoimmune because if especially gluten, dairy are some triggers, they can even some environmental bacterial imbalances when these large proteins enter and start attacking, and your body just starts identifying too many toxins and then starts attacking you. So you really don't want to have the leaky gut, the imbalance. Another thing which is very uncommon, and you'll see it in early neonates, is genetics. So congenital hypothyroidism, dysfunction in the genetic control of it. So that's pretty rare. Pregnancy can cause it. So you get high levels of thyroid hormones, and then they rapidly decline at postpartum and causing a postpartum thyroiditis. It usually lasts 12 to 18 months, but sometimes it can turn into permanent hypothyroidism. Having exposure to radiation too can also create some of this. Some interactions with medications are causes, especially cancer drugs, heart medications, and psychiatric drugs can have this. Stress, emotional stress. So, what are your cortisol levels? What's your adrenals? If they're disturbing the neurotransmitters, creating this low energy, low mood, low concentration, weight gain, disruption in sleep. So, controlling the stress can create some of that. So, I had a classic case of a gentleman who had probably a little bit of leaky gut, and wasn't detoxifying and having environmental exposure. So we cleared out his liver, detoxified, and we took out the toxins that were creating leaky gut. And his stress was out of this world, and normalized the stress, and his thyroid became back. He was hyperthyroid. Got to move that body. So lack of exercise, lack of activities can be something. So you want to move. So that's a little bit of that, but of hypothyroidism to give you an idea. And I think sometimes this gets missed and underdiagnosed, and then people are being treated symptomatically because they're depressed, they're having anxious, um, they're just can't lose the weight, and put on different medications. So make sure that you get that checked. um, Thyroid nodules. So that's, as I said, the lump in the neck. If it's so, ultrasound is the best way. Having that checked and looking down, more maturity, having that because you might have more nodules. Um, 95% of them are non-cancerous. 5 to 10% turn into malignancy. They can you can have a sense of fullness in the neck, difficulty swallowing, pain, choking sensation, breathing difficulty. Um, and if you get hyperthyroidism, thyroxine, you'll elevated will develop nervousness, anxiety, sleep disorders, palpitations, weight loss, unexplained weight loss. Um, just muscle loss. So things that you want to correct or are going to look at. I'll give you a little list of things here. Just want to check your iodine, the Hashimoto's inflammation, the hypothyroid, and what's going on into your diet. If over inflammatory diet, not whole foods and processed. Overgrowth of the thyroid tissues. You can have thyroid cysts. You can have the goiters. They can turn into cancer. Women are probably more commonly have goiters. As I said, more mature age, low iodine, exposure to radiation, and ultrasounds is a common way to identify these things. So how they would treat these things is the radioactive iodine, lasering, ablation, things like that. If you want to do a little bit more natural, you're going to try to have iodine, take your selenium, zinc, avoid inflammatory foods, reduce your stress. Ashwagandha is good, probiotics, avoid toxins. Right? So just little quick tidbits on that. And then I go to so I may have skipped around, but I may just talk about hyperthyroidism, a little quick overview. That's just an overactive thyroid, which can lead to heart problems if you don't address it. So your thyroxine and your T4, they're just idling. Maybe they're just going too fast. So you have unexplained weight loss. You may have palpitations, arrhythmias, irregular arrhythmias. Nervousness, irritability, tremors, sweating, changes in menstrual patterns, increased sensitivity to heat, changes in a bowel pattern, possibly making a goiter, so thyroid becomes swollen, feeling fatigue, muscle weakness, trouble sleeping, thinning of your hair, brittle hair, things like that. So just I didn't mention, I may have didn't mention the causes of hypothyroidism. Is more commonly the autoimmune Graves' disease. So sometimes gluten is a trigger because if you have the leaky gut and you have that and you have the antibodies, then you need to stay away from gluten because it's attacking your thyroid. And if you have nodules or you're having thyroiditis, inflammation of the thyroid because of this autoimmune and making it functioning slower. So you want to make sure, as we said, correct the leaky gut, check your toxicity, get your hormones balanced, look for foods that are causing inflammation, things like that. The gentleman who I was talking to about it, I checked for his foods too, and it turned out that he was not allergies, but sensitivity and causing inflammation, because I can test for inflammation itself, was almond, zucchinis, and gluten. So he eliminated that and eliminated stress and cleaned things out and reversed his hyperthyroidism. So conventionally with hyperthyroidism, they're going to use a PTU, medications to block that, or radioactive iodine surgery. Um, Things that we would do naturally um, with this would be eating whole, clean foods, green juices, anti-inflammatory um, adaptogens or herbs like um, basil, rosemary, um, uh, oregano, bone broth. You're going to avoid high iodine foods like seaweed when you're, um, having having too much conventional dairy and gluten, artificial flavors and dyes, sugar, processed food. So these, so um, the other, well, I just want to say also mints, the mint leaves like bugleweed, lemon balm can also be helpful and protective component for overactive thyroid, essential oils too, and just reducing your stress and working and minimize the exercise, the different types of exercise that you have. And you don't want to have uncontrolled hyperthyroidism because it can lead to hypertension, arrhythmia, dilation of the cardiac, congestive heart failure, and um, sudden cardiac death. Um, so just to be aware, your thyroid can overact, can underact. You can develop nodules that can be benign, that can turn into cancerous. They can just be there and live peacefully with you. And the main thing is to not have an inflammatory diet, reverse that, watch for symptoms. If you have an accumulation of symptoms, get your thyroid checked and make sure that that's being monitored, and try to have your gut healthy and not inflamed, and try to be able to detox and not get a lot of toxins. That I'm here to help you. Hopefully this kind of a little bit of tidbit of understanding of the thyroid and its functionings, because it does so much and balances your metabolism, your weight, and your mood, and so many things. And we need to have that functioning to for you to be vital. So if you find this information helpful, please share it. If And share it, like it, pass it on, and if you make any changes in your lifestyles or anything, you need to consult your doctor before you make any changes. And if you would like, I'm happy to work collaboratively with your physicians on to optimizing, and they can think of me as a subspecialized specialist in optimizing your health. And I can be reached at my website, anitawangmd.com, or 949-734-0580. And you can schedule a complimentary discovery call with me. Till next time, be safe and well.